As TB budget cuts, that is, near, artificial intelligence may soon be an effective tool in the fight against tuberculosis infections in South Africa. According to research epidemiologist Dr Kristina Wallengren, AI data analysis and interpretation could help us assess the effectiveness of TB interventions and prioritize resources. So how exactly will this development help in the fight against TB in the country? Well, Dr. Wallengren joins us now via our video link. And Doc, it's great to have you in the program. Thanks very much indeed for making time. You know, it's the World Health Organization that's put South Africa among the top 5 countries with the highest burden of TB in the world. How are we hoping AI will help us fix this?
Thank you for having me. Well, with AI, it's a revolution putting AI in the hands of normal people, I would say, even in doctors and NGOs. And with AI, we can do good better. And so that is what we're hoping to be doing with some of the projects that we have, starting with the Bill and Melinda Gates Foundation.
Yeah, and when we speak about artificial intelligence, that's an incredibly broad kind of area of study even. Help us kind of distill at which point the intervention will be, because you can use AI, for instance, to treat people, you can use it to analyze data, you could use it to better understand the disease itself. What is this collaboration hoping to do?
Yeah, so AI has been around for a while, but it has been, so far it has been in a black box. And in our hands, the black box of AI is literally a black box that we have used to screen people for changes in the lung using digital chest X-ray screening. So these are mobile clinics that we have been taking out into the rural communities or wherever they are needed, so that we can, with chest X-rays, be able to look at who may or may not have TB. So that is read by artificial intelligence, and where AI comes in and makes a difference, because there simply aren't enough people who timely in a good manner are able to diagnose or look at those chest X-rays and say, what do they mean? So that is already how AI right now is and has been making a difference in South Africa and in the world.
Sure.
Please
go ahead.
So some of the new initiatives that we're working on at the moment is now that AI is out of the black box, as I started to say, where we can use large language models. And the groundbreaking thing in the work that we're doing is that we are applying large language models to data analysis. And so we are looking at routine data in the Department of Health and really helping to use the data for decision support.
Right. What I was going to ask you is something you've just mentioned. You know, like cancer, TB is treatable, but time is so important. And I suppose, given the capacity constraints even in the country, over and above the budget cuts, being able to diagnose quickly enough so that treatment can begin is incredibly important.
Yes, absolutely. Some of the struggles and the reasons why TB is so high in South Africa and in other places is that there is a lot of stigma that's attached, and people are not forthcoming to seek the care or be diagnosed or linked to treatment when they need to. And in all this time, the infectious is continuing to spread. And so that's why timing is really, really important.
Yeah. Can we speak about whether or not healthcare practitioners who have to interact with this kind of technology are themselves receiving the kind of skills development in order to do that meaningfully? I mean, how worried are you about that aspect of the chain, if you like?
Yeah. So South Africa has particularly overburdened the overburdened healthcare sector in general. So any shape, way, or form that we can help each other support each other better is critical. And there are also a lot of AI development that really goes into developing tools that are for the healthcare workers themselves, so that they can make decisions better or even follow guidelines or know what the latest guidelines are better. There's with AI, we're able to crack the nut of too much information, but not the information when and where we need it. And so yes, that we will be able to help people in the healthcare sector who have the patients in front of them.
Yeah, whenever we speak about artificial intelligence, the skeptics among us always raise concerns about whether or not we're going to get to a space where it completely replaces people, for lack of a better term, right? Whether it's in journalism with ChatGPT, lecture rooms in universities, and perhaps whether it's with healthcare workers in the healthcare sector. Is that a concern you share? I mean, how far can we take this?
Yeah, I hear you, and this is a common argument. The short answer would be AI is not going to take your job, but the person who uses AI is going to take your job. So, but distilling it a little, it really is with AI. It helps us do our job better, right, with higher quality. So if you look back at the past 100 years, the development has been really on improving quality. We can produce more in terms of number, but looking forward with AI, we can produce better quality. And I think that is the era that we're looking forward to with AI. And that is going to go across all of the sectors, of course, including journalism, but including healthcare, financing, work, in any sector.
Yeah, I better update my knowledge on ChatGPT at the very least for job security. But on a much more serious note, this helps us improve the quality of care we can provide. But what bearing does it have to the cost of care? Is that something that, patients potentially of TB need to worry about?
No, not at all. I would say, if anything, by doing good better, that should also make sure that the quality of the care that we do receive should be at the same or reduced cost going forward. I can't see how this should be a negative factor for people receiving the care. On the contrary.
Right. And, South Africa, for instance, has always been seen as a much more advanced kind of market across a number of sectors. But if there's going to be meaningful work done to overcome TB in the country, I imagine it needs to be a kind of regional response. How close are we to getting that particular aspect of the fight against TB right?
There's a lot of regional initiatives already happening, and both regional within South Africa, but regional outside of South Africa too. And because a lot of the challenges that we're facing, in our regions are cross-cutting, not just cross-cutting across the country, but across sectors. And so it makes sense to participate in this. And as an example, we're working on a regional project that includes mental health, because the one thing I think is important for us to recognize as we speak about AI is that tuberculosis, for example, cannot be fixed with a pill or a pill alone. It really is a disease that is related to overcrowding, to poor nutrition, to other conditions such as alcohol and diabetes. So health starts at home, and hospitals are made for repairs. And in that whole holistic understanding about what TB is and how it affects us, we must include all factors from education and now to mental health, as I said. And there we're working on a regional program that is really aimed to bringing in the mental aspects of our health and well-being in order to be able to sustain or to carry through the long-term treatment that actually tuberculosis consists of. Currently 6 months for normal TB or longer for drug-resistant TB. But this is the same with many other conditions where it's lengthy periods of treatment, and our mental health and well-being is critical to be able to endure that.
Right. If we get this right, I think it's not overstating it to say it'd be revolutionary. How quickly do you reckon we can start seeing the rewards or the effects of this kind of technology? Or, in fact, are we already seeing that already?
Well, on one hand, you can say that we're already seeing it because we're using AI to screen for tuberculosis. So yes, in fact, we are already seeing an effect of AI in our lives, even without us even not having paid attention to it so much. The reason we're paying so much attention to it now is because it's come out of the black box, and we're able to see so many different other utilities. So it is already helping, and the future of AI is revolutionary and really increasing at a logarithmic scale. So we will see much more of AI tools to be able to help us in all kinds of spheres, no doubt.
Absolutely, especially given what a difference it could make. Dr. Kristina Wallengren, it's been great chatting to you. Thank you so much indeed for your time. Really do appreciate it. Dr. Kristina is an epidemiologist, also the CEO of Think, which is a non-profit organization that focuses on healthcare, including HIV and TB responses. Once again, Doc, thanks very much indeed for your time.